Spanish flu, the beginning of the deadliest pandemic of the 20th century. Imagine a world already consumed by years of relentless war. On the battlefields of World War I, thousands of soldiers were dying every single day. Cities were overflowing with wounded men. Hospitals were stretched beyond their limits, and families anxiously waited for letters from the front, fearing the worst. But just when humanity believed nothing could be more terrifying than war, another enemy appeared. An enemy that wore no uniform. An enemy that carried no rifles, tanks, or artillery. An enemy that ignored borders and armies alike. It was a virus that would change the course of history. The world would come to know it as the Spanish flu. According to historical estimates, the pandemic infected nearly 500 million people, almost one-third of the world's population at the time. Between 50 and 100 million people lost their lives, making it one of the deadliest disasters in human history, claiming even more lives than World War I itself. But where did this deadly virus come from? Why was it called the Spanish flu? And how could what seemed like an ordinary strain of influenza become one of history's greatest catastrophes? Today, we travel back more than 100 years to uncover the origins of the pandemic and follow its path from a mysterious outbreak to a global disaster. The year was 1918. Europe had been devastated by nearly 4 years of war. Millions of soldiers lived in muddy trenches where cold, hunger, exhaustion, and constant fear had become part of everyday life. Many survived on poor food, slept only a few hours a night, and often had little or no access to proper medical care. These harsh conditions created the perfect environment for infectious diseases to spread. At that time, influenza was already a familiar illness. Seasonal outbreaks occurred almost every winter, and while the disease could sometimes be dangerous, most people recovered within days. No one imagined that this outbreak will be different. Even today, historians and scientists continue to debate where the virus actually originated. One of the most widely accepted theories points to Camp Funston in Kansas, United States. In March 1918, an Army cook named Albert Gitchell reported to the camp hospital with a high fever, sore throat, and extreme fatigue. Within hours, dozens of soldiers developed the same symptoms. Within days, more than 1,000 men had fallen ill. As American troops crossed the Atlantic to join the war in Europe, they unknowingly carried the virus with them. Another theory suggests that the outbreak may have begun in northern France, where enormous military camps housed hundreds of thousands of soldiers living in crowded conditions. Some researchers even believe the virus may have originated in China before spreading west through laborers who were transported to Europe to support the Allied war effort. More than a century later, the true birthplace of the Spanish flu remains one of history's greatest medical mysteries. There is another fascinating detail. Despite its name, the pandemic did not begin in Spain. So why is it called the Spanish flu? The answer lies in wartime censorship. During World War I, countries involved in the conflict tightly controlled the information published by newspapers. Governments feared that reports of widespread illness would damage public morale and weaken military confidence. Spain, however, remained neutral throughout the war. Without strict wartime censorship, Spanish newspapers openly reported the growing epidemic. The story became international news when King Alfonso XIII of Spain also became ill, as newspapers around the world repeatedly reported Spain's outbreak. Many people mistakenly assumed the disease had originated there. In reality, the virus had already spread across numerous countries. Because of censorship and a misunderstanding that spread through the media, the name Spanish flu has remained with the pandemic ever since. During the spring of 1918, the first wave appeared relatively mild. Patients experienced fever, coughing, headaches, muscle pain, and exhaustion. Most recovered within a few days. Doctors believed they were dealing with nothing more than an unusually widespread seasonal flu. No major quarantines were introduced. No vaccines existed. No antiviral medicines were available. People continued traveling by train, attending schools, working in factories, shopping in crowded markets, and gathering in theaters. Meanwhile, the war accelerated the spread of the disease. Every day, thousands of soldiers crossed borders, boarded ships, and traveled across continents, unknowingly carrying the virus into new regions. Within just a few months, influenza had spread throughout Europe before reaching Africa, Asia, Australia, and South America. The world still had no idea that this was only the beginning. Doctors desperately tried to understand what they were facing. At the time, medical science knew very little about viruses. Many physicians believed the disease was caused by a bacterium known as Pfeiffer's bacillus, leading them to use treatments that proved largely ineffective. Patients were prescribed mixtures, rest, warm compresses, and sometimes extremely large doses of aspirin, treatments that occasionally made their condition even worse. Meanwhile, the virus continued spreading rapidly. Military camps, factories, hospitals, schools, and crowded cities became ideal places for transmission. For a brief moment, it seemed as though the danger had passed. The first wave gradually faded. In many countries, life began returning to normal. Newspapers devoted less attention to the outbreak. People believed the epidemic was coming to an end, but the virus had not disappeared. It was changing, and soon, it would return far more deadly than before. The second wave would become one of the most devastating public health disasters in human history, killing millions of people, including countless young, healthy adults who were expected to survive. The second wave of the Spanish flu. The second wave of the Spanish flu arrived like a nightmare. Only a few months earlier, many doctors believed the epidemic was beginning to fade. The first wave had been relatively mild, and while thousands had fallen ill, most patients recovered within days. People hoped the worst was already behind them. They were wrong. Somewhere during the summer of 1918, the virus changed. Scientists today believe it mutated into a far more aggressive form. When it returned in late August and September, it was no longer an ordinary influenza outbreak. It had become one of the deadliest diseases humanity had ever faced. This time, people weren't just getting sick, they were dying at an astonishing speed. Healthy young adults who had been working in factories or serving in the military could develop a fever in the morning and be dead within a few days. Entire families became ill almost simultaneously. Hospitals filled beyond capacity, and doctors were forced to treat patients in hallways, schools, churches, and temporary emergency facilities. No one seemed safe. The symptoms were terrifying. At first, they resembled ordinary influenza. Patients developed high fevers, headaches, chills, sore throats, and aching muscles. Many assumed they would recover after a few days of rest. Instead, their condition often worsened dramatically. Violent coughing fits became common. Many patients struggled to breathe as fluid rapidly filled their lungs. Their lips, fingers, and faces turned dark blue due to a lack of oxygen. Witnesses described scenes unlike anything they had ever seen. Some patients appeared to be suffocating while fully conscious. Others became so weak they could barely speak. Doctors reported that blood sometimes appeared in the foam coughed up by severely ill patients, a sign of devastating damage inside the lungs. For medical professionals, it was horrifying. At the time, medicine was still limited. Scientists had not yet identified influenza viruses, and there were no antiviral medications. Antibiotics, which would later save countless lives from bacterial pneumonia, had not yet been discovered. Doctors could only offer basic care. They tried to reduce fever, encourage rest, and provide fluids, but many patients deteriorated despite every effort. Nurses worked around the clock, often without proper protective equipment. Many became infected themselves. Some hospitals ran out of beds. Others ran out of blankets. In many cities, there were simply too many patients and too few healthcare workers. The First World War made everything worse. Millions of soldiers lived in crowded trenches where disease spread easily. They traveled constantly by train and ship, carrying the virus across continents. Every military transport became another opportunity for infection. Soldiers returning home unknowingly brought the disease to their families and communities. Within weeks, the virus reached Europe, North America, Africa, Asia, Australia, and countless remote regions. Even isolated villages were not spared. The world had become connected through war, and the virus used those connections to spread with extraordinary speed. Perhaps the greatest mystery of the Spanish flu was its victims. Unlike most influenza outbreaks, which primarily kill infants and the elderly, this pandemic targeted healthy adults between the ages of 20 and 40. This shocked doctors everywhere. Why were the strongest people dying while some older individuals survived? Modern scientists believe the answer may lie in something called a cytokine storm. A healthy immune system sometimes reacted so aggressively to the virus that it damaged the patient's own lungs. Instead of protecting the body, the immune response became dangerously overactive, causing severe inflammation and making breathing nearly impossible. Ironically, the people with the strongest immune systems sometimes face the greatest danger. Fear spread almost as quickly as the disease itself. People avoided crowded streets. Schools closed. Church services were canceled. Theaters and dance halls shut their doors. Public gatherings disappeared almost overnight. In many cities, face masks became common. Police officers, nurses, shopkeepers, and ordinary citizens wore cloth or gauze masks in the hope of reducing transmission. Some governments made masks mandatory. Others encouraged people to avoid handshakes, maintain distance, and stay home if they felt ill. Many of these public health measures would sound familiar even a century later. But fear could not stop the pandemic. In some communities, so many people became sick at once that essential services collapsed. Mail was no longer delivered. Public transportation slowed or stopped. Factories struggled to remain open because too many workers were absent. Even hospitals faced shortages of doctors, nurses, and supplies. Funeral homes became overwhelmed. There were not enough coffins, not enough grave diggers, not enough time. Entire communities struggled simply to care for the dead. Newspapers published heartbreaking stories every day. Parents lost children. Children lost parents. Some families disappeared almost entirely within a single week. Neighbors cared for orphaned children because there was no one else left. Volunteers delivered food to homes where everyone was too sick to leave their beds. The sense of uncertainty was overwhelming. No one knew who would be next. Despite the tragedy, acts of courage appeared everywhere. Doctors continued working despite exhaustion. Nurses risked their own lives every day. Volunteers cared for strangers. Communities organized food deliveries and emergency shelters. Even in humanity's darkest moments, compassion endured. People realized that survival depended not only on medicine, but also on helping one another. By the end of 1918, the Spanish flu had become a truly global catastrophe. The virus crossed oceans, borders, and cultures without discrimination. It reached nearly every populated corner of the planet. And yet, the worst was still unfolding. The Spanish flu is the deadliest pandemic in human history. By the autumn of 1918, the Spanish flu had reached nearly every corner of the world. What had begun as a mysterious outbreak had transformed into one of the deadliest disasters in human history. Cities that had once been filled with busy streets, crowded markets, and lively conversations suddenly fell silent. Fear was everywhere. People no longer looked at one another the same way. A simple cough could empty a room. Friends stopped visiting each other. Families avoided gatherings, and parents worried every time their children left the house. The invisible enemy had changed everyday life. Hospitals were collapsing under the weight of the pandemic. Every available bed was occupied. When there was no more space, patients were treated in school buildings, churches, gymnasiums, and temporary emergency hospitals. Doctors worked day and night with almost no rest. Many had no effective medicine to offer. They could only monitor patients, reduce fevers, and hope the body would survive the infection. Nurses became the true heroes of the pandemic. Many worked for weeks without taking a proper break. They cared for hundreds of patients while knowing that every shift increased their own chances of becoming infected. Thousands of healthcare workers eventually lost their lives while trying to save others. Outside the hospitals, the situation was just as heartbreaking. Entire families became sick at the same time. In some homes, there was no healthy person left to care for the others. Children sometimes watched helplessly as their parents became weaker each day. In many cases, neighbors stepped in to deliver food, water, and medicine. Communities relied on volunteers more than ever before. Without them, countless more lives would have been lost. The pandemic also exposed the limits of governments. Many officials underestimated the danger during the early stages. Some feared that public warnings would create panic. Others worried that admitting the true scale of the outbreak would damage morale during World War I. As a result, valuable time was lost. By the time many cities introduced restrictions, the virus had already spread widely through the population. Different countries responded in different ways. Some closed schools immediately. Others banned concerts, sporting events, and religious services. Public transportation was disinfected regularly. People were encouraged, or sometimes required, to wear face masks in public. Large gatherings became illegal in many places. Police officers even fined people who refused to wear masks. Although these measures were not perfect, modern research suggests they helped slow the spread of infection where they were introduced early. One city often stands out in history. In the United States, Philadelphia decided to hold a massive parade in September 1918 despite warnings from medical experts. More than 200,000 people crowded the streets. Within days, hospitals were overwhelmed. Thousands became infected in an incredibly short period. Only weeks later, thousands of residents had died. Meanwhile, other cities that canceled large public events earlier generally experienced lower death rates. The lesson was clear: delaying action could cost countless lives. Another terrifying aspect of the Spanish flu was its speed. Some people felt perfectly healthy in the morning. By evening, they had developed a high fever. Within a day or two, severe pneumonia could develop. For some patients, death came in less than 72 hours. Doctors had never seen anything like it. Many believed they were facing an entirely new disease. Scientists today know that many victims did not die from the virus alone. The influenza infection severely weakened the lungs. This allowed dangerous bacteria to cause pneumonia, which became fatal for millions of patients. Because antibiotics had not yet been discovered, doctors had almost no way to stop these secondary infections. A disease that would often be treatable today became a death sentence in 1918. The emotional impact of the pandemic was enormous. People lived in constant uncertainty. Every knock on the door could bring terrible news. Funerals became a daily occurrence. In some cities, there were so many deaths that funeral processions became impossible to organize individually. Mass graves were dug because cemeteries could no longer keep up with the number of victims. Families were often forced to say goodbye without the traditional ceremonies that had comforted people for generations. Yet, even during these dark times, stories of hope continued to emerge. Doctors volunteered in the hardest-hit communities. Students left universities to help care for patients. Religious organizations opened shelters for the sick. Ordinary citizens cooked meals for families in quarantine. Acts of kindness reminded people that humanity could still stand together, even in the face of unimaginable tragedy. By early 1919, the pandemic slowly began to weaken. Fewer new infections were reported in many regions. Hospitals gradually emptied. Schools reopened. Factories returned to normal production. Life slowly started to resemble what it had been before the outbreak. But nothing was truly the same. Millions of families had lost loved ones. Entire communities carried emotional scars that would last for generations. The Spanish flu had forever changed the world. Easing the pandemic. By the middle of 1919, something remarkable began to happen. The number of new infections started to decline. Cities that had once been overwhelmed with sickness slowly returned to life. Hospitals admitted fewer patients. Schools reopened their doors. Businesses welcomed customers again. Streets that had been silent for months gradually filled with people. The worst appeared to be over. But one question remained. Why did the pandemic end? Scientists believe there was no single reason. Over time, millions of people had already been infected and developed some level of immunity. The virus itself also changed, becoming less deadly as it continued to spread. Public health measures such as quarantines, isolation, improved hygiene, and restrictions on large gatherings helped reduce transmission. Together, these factors slowly brought the pandemic under control. Even today, experts cannot agree on the exact number of victims. The official estimates vary widely. Most historians believe that at least 50 million people died during the Spanish flu pandemic. Some researchers argue the true number may have been closer to 100 million. To understand how devastating that is, consider this. The pandemic killed far more people than World War I itself. At a time when the world population was only about 1.8 billion people, roughly one-third of humanity became infected. Few events in history have affected so many people in such a short period. The pandemic reached places few diseases had ever reached before. Remote villages in Alaska, small islands in the Pacific Ocean, communities in Africa, cities across Asia. Almost nowhere on Earth escaped its impact. In some isolated villages, nearly every resident became ill. Entire communities disappeared. The Spanish flu proved that infectious diseases recognize no borders, languages, or political systems. The pandemic also transformed medicine forever. Before 1918, many governments were not fully prepared for global disease outbreaks. After the Spanish flu, countries began investing more in public health systems. Hospitals expanded. Medical research received greater funding. Scientists worked to better understand viruses and how they spread. International cooperation on disease surveillance became increasingly important. The tragedy encouraged the world to prepare more seriously for future pandemics. One of the most important lessons involved communication. During World War I, censorship prevented many governments from openly discussing the outbreak. Officials feared that reporting the truth would damage public morale. Instead, silence allowed the virus to spread unnoticed. The Spanish flu demonstrated that transparency can save lives. Quick reporting, accurate information, and public trust became essential tools in fighting future epidemics. The pandemic also changed everyday habits. People became more aware of hand washing. Hospitals improved sanitation practices. The importance of ventilation, isolation of infected patients, and disease prevention became much better understood. Many of these ideas remain fundamental to public health today. More than a century has passed since the Spanish flu swept across the globe. Medicine has advanced beyond what doctors in 1918 could have imagined. Today we have vaccines, antiviral drugs, antibiotics to treat secondary bacterial infections, intensive care units, advanced laboratory testing, and global communication systems. Yet history reminds us that new diseases can still emerge. The Spanish flu remains one of humanity's greatest warnings about how quickly an infectious disease can change the world. Although millions lost their lives, the pandemic also revealed something extraordinary about humanity. Doctors continued treating patients despite enormous personal risk. Nurses worked until exhaustion. Volunteers delivered food to strangers. Families cared for loved ones even when they knew they might become infected themselves. Acts of courage appeared everywhere. In humanity's darkest moments, compassion never disappeared. Today, the Spanish flu is remembered not only because of the staggering number of deaths, but because it reshaped modern public health and scientific research. Its legacy continues to influence how countries prepare for outbreaks, how hospitals respond to emergencies, and how scientists study infectious diseases. The lessons learned over a century ago continue to protect millions of lives today. Interesting facts. Here are a few fascinating facts about the Spanish flu. The name Spanish flu is misleading. Spain was not necessarily where the virus originated. It became associated with the pandemic because Spanish newspapers freely reported on the outbreak, while many countries at war censored such news. Most influenza outbreaks mainly affect the elderly and very young. The Spanish flu was unusual because it killed many healthy adults between the ages of 20 and 40. The pandemic infected an estimated 500 million people, nearly one-third of the world's population at the time. Scientists successfully reconstructed the virus decades later by studying preserved tissue samples, helping researchers better understand why it was so deadly. The pandemic occurred in 3 major waves, with the second wave in late 1918 being, by far, the deadliest. Otro. The Spanish flu was more than a pandemic. It was a turning point in human history. It showed how connected the world had become, and how quickly a microscopic virus could cross oceans, continents, and borders. More importantly, it taught us that science, cooperation, honesty, and compassion are among humanity's strongest defenses against global disease. History cannot be changed, but it can teach us how to face the future. Thank you for watching. If you enjoyed this documentary, don't forget to like the video, subscribe to the channel, and leave a comment about which historical event or pandemic you'd like to see explored next. See you in the next video.